Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations today for November 11th, 2022, Veterans Day. And this is a time to go ahead and call out those of us who are veterans for their service. I think what we find is that there are so many people in government service who have had some military background, and that's great. I think for me personally, being in the military made it very easy for me to attend medical school and really gave me a great background in some of the things that we do today. If you have questions, please get them into us today at Facebook questions at douglaspublichealthnetwork.org. We have one question today, and the question today is about, are we going to just continually need boosters? I'm really, really tired of getting a booster. And unfortunately, it appears that the answer is yes, that the immunity from coronavirus, either infections, if you had a natural infection, or the immunity that you get from the vaccines is not going to be long lasting. So a vaccine you got a year ago or 2 years ago now is not going to give you a whole lot of protection against the disease. We have seen, for example, people who got the disease 6 months later get it again, 6 months later get it again, suggesting that natural infection is okay, but not long lasting. And we've also seen that the immunity that you get from the vaccines is, again, good, but not long lasting. So I think we are probably going to be in a stage where we need a booster every year, or maybe even twice a year, to get optimal protection. And the booster is incredible. We have been looking at our cases and our hospitalizations. We do not think we have a single case among people who got the recent bivalent booster. We certainly have not had any hospitalizations or deaths among people who had the bivalent booster. So the bivalent booster is really good against giving short-term protection against COVID infections. The situation with COVID is pretty quiet, and the world is pretty quiet. We're not seeing big increases really anywhere in the world. The increases that we feared in Northern Europe really have kind of flattened out. And there are little scattered places around the globe, but overall, COVID is under pretty good control. We are starting to see some new variants, including the BQ and the BA and the BF, some of which may not be as well affected by the monoclonal antibodies, but they really haven't taken off. At this point, what we're seeing is just a mixture of different variants that are causing that. In the U.S., things are quiet. There are scattered pockets of disease in the U.S., but I don't think there's any really big trend. Oregon has been really quite quiet in COVID, and similarly, Douglas County has had some of our lowest numbers. So I think it's been a week or so since we've had somebody in the hospital who's been really sick with COVID. So that's really, really good news. But the best way to protect yourself against disease and against hospitalization is to go ahead and get the bivalent booster. One of the things that we are worrying about is not so much about COVID, but about flu and a virus called RSV, or respiratory syncytial viruses. So flu and RSV are old viruses. They've been around way before COVID. But these viruses come around every winter. They're both contagious, not nearly as contagious as COVID, but they're both contagious. And because over the last few years, people wore masks and they distanced and they stayed home when they were sick, these things did not spread very much in the last few years. But now, since people are gathering more, traveling more, wearing masks less, we are now starting to see them spread. They're especially hot in the Southeast. So when we look at the Southeast part of the United States, they're having a tremendous time with flu and with RSV. The hospitals are filling up, not from COVID, but from flu and RSV. And what we're worried about is that if we have a little spike of COVID, along with a big spike of flu and RSV, our hospital could be overwhelmed. And already the pediatric hospitals in the Southeast are pretty full. And the pediatric specialty hospitals, those for pediatric ICU, are also really tight. Earlier this week, we heard that between California and Canada, there were only 2 open pediatric ICU beds. And again, with RSV and flu, little kids can get really sick with those. And we worry that we are going to need, we may come up with a crunch. There is no vaccine for RSV. There is a good vaccine for flu. So again, our best advice is get vaccinated. If you're eligible for a booster, get a booster for both flu and COVID. If you're sick, stay home, because we know that about half of our outbreaks have started when somebody who was sick, not knowing what they had, went to work and spread it to others. So if you're sick, stay home. If you are sick, get tested. If you're positive for either flu or for COVID, talk to your doctor about getting an antiviral med. Again, the antiviral meds, the Paxlovid for COVID and the Tamiflu for flu, are both really quite effective at preventing severe disease, and so that they should be used. In terms of wearing masks, some people are going to want to wear a mask at this time, and we should certainly be gracious to those who want to do that. I think generalized masking is not recommended at this point, although we are still doing masking at clinics, because we really don't want our providers to get sick during this time. So again, COVID's doing pretty well, but we're a little bit worried about flu and RSV. So stay well, get vaccinated, get boosted if you can. Thanks.